Okay, so we're at 5:35, ladies and gentlemen. I think it's a good time for us to get into the nitty-gritty of it all. I'm very, very excited to be hosting today's webinar with IndoorCare to talk about employee wellness and mental health, how indoor air quality affects us. My name is Cameron Quin. I'm the Vice President and COO of Mind You. Thank you to everyone for giving up your evening and joining this webinar on a Thursday night. It is a challenging time where we are now learning new solutions that can help our staff become happier, healthier, and more productive, giving them peace of mind and so that they are able to return to the office without too much stress, anxiety, which is fantastic. I have with me Jeroen van Straten and Matthias Gelber, who is the founder as well as a director from IndoorCare. This is a joint event for us to explore the link between air quality and mental health. So today we'll be going through exactly that. We're going to go in depth to create a better understanding between the link of mental health and air quality. We're going to be going through studies showing the relationship between air pollution, mood, and productivity. We're going to be understanding what constitutes air pollutants and which pollutants specifically occupy indoor spaces. I tell you what, that was a lot of surprising stuff from my perspective. We're going to talk about how indoor pollution affects our mental health. We're going to be looking at IndoorCare services and office plans. And also, there's going to be a bit of a giveaway for a complete floor of an organization to be covered by IndoorCare and a secondary prize of a indoor air quality assessment given out by the guys at the end, which is really, really fantastic. So I wanted to introduce both of our presenters today. Jeroen van Straten, who is the founder of IndoorCare and is an entrepreneur and involved with several organizations in various industries. One is a company that handles clients who have indoor air quality issues in their offices that results in employee health and wellness concerns with absenteeism and resignations as a result. He could not find any company that could solve the poor indoor environment issues and help provide healthy indoor work environments for building occupants. And this led him to start IndoorCare in 2019, just prior to the COVID-19 pandemic taking the world by surprise. Thanks so much, Jeroen, for being here with us today.
Thank you, Cameron. Thank you.
And we have the director, Matthias Gelber of IndoorCare, who's pursued his passion to help the planet with a Master's of Science degree in environmental science. And in 2008, he was voted the greenest person on the planet in a global online competition. And he received the Green Icon of the Year award in Malaysia in 2016. He built Southeast Asia's first off-grid tiny mobile eco home in Malaysia in 2017. And he has given eco talks in a professional capacity in 42 countries worldwide. Locally, he has been a consultant and trainer for ADB, DTI, CITEM, and many other organizations. Currently, he is the sustainability director of GSX Exchange. He is an ESG advisor for the Philippine Stock Exchange and brand ambassador for IndoorCare. So thank you all so much. If you have any questions throughout the entire presentation, please put them in the chat. If you really want to get in there, you can unmute yourself. We're not going to be controlling that today. This is going to be a very fluid conversation. But yeah, thank you so much, Matthias. I'm going to hand it over to you.
All right, great. Thanks so much, Cameron, for the great introduction, and welcome everyone this afternoon. I'm based in San Pablo City, Laguna, so far away from the hustle and bustle of Metro Manila. Maybe that gives me additional mental health benefits of being close to the mountains. I don't know, but I guess so. So I'm enjoying my time down here. Fortunately, I have a decent Wi-Fi connection, and that keeps me connected with the rest of the world. So I'm not sure where you guys are all based, but some of you are from home, some of you are in the office. But as Cameron already said, we really appreciate that you're here and that you're with us. So that's great news. I will share with you a couple of ideas on what's going on, some observations, latest technology, and starting off with this simple question: where do you really feel good? If you look at those four different scenarios, beach, car, forest, or inside of the office, any one of you that feels best inside of the office? Nobody raising their hand? Actually, that could, I guess, only be possible for people who are quotation mark workaholics, right? I mean, some people love their car so much that they will feel great in it. But I haven't had a car for the last 10 years until a week ago when my wife finally said, we got to get a car because we can't really move anymore with the pandemic. So yes, and I'm not allowed to use public transport anymore. I used to do that. But yeah, you know, this is usually where we feel best. Here for the Philippines, the beach is where people want to go. In my barangay in Germany, where I grew up, the beach was far away. The forest was for me the place to go, to feel good, to feel energized, to feel, you know, really like nothing can stop you. And even sometimes when you have to think, or when you are, you know, not so feeling so good, you really want to have that experience. And looking at the comments here, yes, definitely the beach. I'm going with the beach. Ronald wants to go to Boracay, and Jerome beach with a cocktail. And then Beverly, it's the forest in the mountain. Yeah, Beverly, I'm with you. My first choice is the forest, but that's maybe because I grew up in a barangay surrounded by forest. Actually, my barangay has more than 60% of the land surrounding it is forest. And I have to admit that even though I'm known as the green man, when I was a youngster, my dad occasionally took me to the forest to chop down some trees. And I kind of didn't feel so good about it in a way, because I was thinking, hey, we're killing the trees. But in a way, it's done in my village. The forest is owned by the village community, and it's done in a sustainable way. Every year, only a small part is chopped down, and that small part regenerates by itself within 30 years. So it's a very sustainable way of actually managing the forest. So these are really the places that we love, that we feel good, that we are at home in, and that is really giving us that good feeling, that good level of negative ions. Now, why do we feel good when we are out there outdoors? The smell of the ocean, the breeze, it gives us a soothing state. It's the negative ions that we are breathing in that make us feel comfortable. And even some scientific research, increased levels of mood chemicals, serotonin, that is what we get. And it helps us to relieve depression and stress and boosts our energy. I mean, the Japanese do the forest bathing, right? As a therapeutical method to really help people with mental health issues and stuff like that. This is real. This is not just some kind of an idea. This is already being offered even as therapy in some countries. But, you know, then the reality hits us. You know, we're back in the office and maybe it evaporates. But the question is, can we do something about it to actually optimize it? In the context of some scientific research, here is Harvard University. In addition to air pollution in the workplace that can have a negative impact on our employees' mood and cognitive ability, it can cause them to experience fatigue, mood swing, depression, and loss of concentration, resulting in an unhappy working environment and lower productivity. This can be the result of bad air quality. So most of you might have never made that linkage. Maybe sometimes in certain rooms, we feel very sleepy. This might have to do with the levels of carbon dioxide. We'll come back to that later on, and oxygen levels. Here is another article in the medical news today, the link between mental health and air quality. Anxiety is the most common psychiatric disorder globally, affecting 16% of people at some point in life. So this is actually big news. This is serious stuff. And this is something I think worth looking at. I'll just bring in Cameroon and Jeroen. We'll make this a bit interactive. I want to get their feedback when they first understood and heard about this link between air pollution and mental health. I mean, Cameroon, you're a mental health professional with your business. Where did that? When did you first see that link?
With IndoorCare. So when we met with Jerome, it was actually really quite interesting sitting down with him and going through and understanding a bit more about how that link works and why it happens. I don't want to ruin any of your slides later on, so I'm not going to talk too much about it. But we then spoke to some of our advisors, neuropsychiatrists from over in the US as well, and they reaffirmed that what you guys are saying is actually true, and that these systems are actually used in hospitals for the virus control and a whole bunch of other stuff like that. So once we knew that, we knew we were on the right track to another solution for overcoming mental health issues in the workplace.
Great, excellent. How about yourself, Jeroen? I mean, you started the company 2019, but when did you first learn about that linkage?
Well, in our other company that we run does the indoor air quality assessment for the past 8 years already, and those assessments are all done in large corporations, BPOs, entire buildings all over the country. And we've realized that time already that the assessments that we've done, the indoor air quality was always poor. It always came back unhealthy. We could see high pollutants, formaldehydes, PM levels or dust levels are high. The density, it's too dense. You cannot open windows. The lighting is not good. So a lot of things are linked to our well-being. And then we started to realize, as I said, there is no solution. I mean, the companies that we do assessment for don't know how to take care of it. So we made the link ourselves, because these employees, they come to their HR and they say they have headaches, they don't feel well, they cannot concentrate, they don't feel good. But the opposite, they look good, right? Everything is there, but somehow they don't feel comfortable. And we made the connection, the link a couple of years ago already, but just this pandemic really brought the awareness to how important the indoor environment is. And then I started to research for mental health institutions. I said, I want to meet up with some experts and some people like Cameron. So I contacted him, we had a coffee, we went to his office, and basically the rest is history. I've been working together along the way already to create more awareness.
Great. I think it's a very important link, and it struck me as well. I was hosting a webinar a couple of months ago, and the owner of Menarco Tower was one of my speakers, and she was saying the old office building they had in Makati, they needed a nurse to look after people because a lot of employees there had migraines and other health issues. Since they shifted to the new building, which is a lot more zen, good indoor air, plants and stuff like that, she still has a nurse, but the nurse has hardly any job to do anymore because the feeling of people inside of the building is much, much better than what they experienced before. That was interesting. So there is really that contrast that they experienced within the context of a building in Metro Manila. So we really need to take this serious. And we take it serious, for example, when we drink water, right? The left side, you would not touch that one. If you get any water that is dirty, then stop. But what about breathing? You know, we have to breathe, and we are sometimes in environments. The problem is we don't necessarily see the pollution that is occurring because it's not visual unless there is something happening in the neighborhood where, you know, you see the clouds of smoke or whatever else that are occurring. So this is one of the problems. So we need to make it visible. We need to bring it to light. And here we have ETSA in Metro Manila. It's visually detectable that there is a problem. Wasn't that one of the positive side effects of the tragic pandemic that has hit us hard in many ways? But wasn't it amazing to see how suddenly the air was clean when the hard lockdown was happening? And, you know, people could see the Sierra Madre and everything. And it was like, wow, we haven't seen this for 20, 30 years.
It is possible.
Yeah. So incredible in a way. But how can we actually make it more visible? How can we improve it? because in many workspaces, we have too many people in a small amount of space, no plants, no art, no aircon filtration or air movement. And even from Dole, we know now, and the latest results, World Health Organization, the biggest risk is airborne when it comes to COVID. It's actually in the air, the small particles. So we need to do something about the air, and natural light as well is often not available for us. So this is some of the tricky parts, and indoor can be 10 times more polluted than outdoor. What is indoor pollution? Here are some of the examples: VOCs, viruses, bacteria, carbon dioxide, PM 2.5, PM 10. Those are some of the different pollutants in the air. Now, I have had an indoor air quality monitoring device here in my barangay in San Pablo City at home. I'm not going to show you any of the results, but I used to post them on Facebook and surprise my friends with it. And I have had occasionally high PM 2.5. So this is the first quiz question, guys. You might be able to win something if you give a very good answer. Please put in the chat box, what is the main reason for me here in San Pablo City sometimes to have high levels of PM 2.5? Now I'm waiting to see what you guys can come up with.
So this is for the free air test.
Yeah, we will be having a reward for you at the end if you give a very good answer.
Yep.
If you give a very good answer.
We will assess an entire office floor with all the indoor pollutants that we might have. So
Louis is saying smoke from factories. In this case, not. Air pollution, yeah, but that is too general. Ranulf, you need to specify where does the air pollution come from. Then Ronald is as well saying manufacturing fumes, not really from factories or manufacturing. Then we have Yogesh saying pollens. Pollens, my mother in Germany is very affected by that, but I don't really get it here in San Pablo City. I occasionally get high PM 2.5, and it is something that happens in the neighborhood, but it's not from a factory or not from nature. It's something that humans do. Tal volcano eruption, that's a good one. That's a good one, Care. Yeah. At that time, we had some going up. Yeah. From us, human beings. Yeah, Reiki, you're kind of right. Humans have initiated it, but I want to know from you guys, what have the humans done?
Can I
my own breathing, Reiki, my own breathing is contributing something else.
Can I give a small idea? When you're driving along the road, what do you see? There we go.
Oh, yes. We're getting
Yogesh is getting there. Burning of wood. Yeah, actually, it's less so burning of wood. Smoking.
But you're on the right track.
That is sometimes, yeah, the burning of wood is on the right track. The smoking, yeah, my neighbors sometimes smoke. I can smell that as well, but it doesn't really impact my PM 2.5 because it is diluted by that time. Smoke emissions, yeah, you're getting close.
What else do you see burning on the side of the road?
Yogesh says vehicles can contribute. Actually, they contribute to PM 2.5, but again, inside of the house, it doesn't, I can't really detect it so much. So, ihaw, hindi ko maintindihan. What does that mean? Reiki. Grilling on the side of the road. BBQ. Again, BBQ is something similar. Okay, I will say, wow, hot spring.
I want to get it close. So because we need to continue on. Okay, so everyone, basically, this is what you see burning on the side of the road. What do you usually see people burning on the side of the road here? It's not wood, it's not food. There we go.
Yeah.
Garbage. Yes,
he deserves it. He deserves it.
Yeah.
Well
Reiki,
done.
definitely. You get one of our prizes, definitely, because you were always on track. It's the open burning, the garbage in the neighborhood. That is what is actually the problem here in my neighborhood, and it pushes up my PM 2.5. But, you know, very interestingly is actually the indoor care package that I will explain later. We have applied it in my room at the early time of the pandemic. And the other day, my wife was coming into my room and saying, hey, darling, the neighbors are all complaining. They get migraine because the open burning doesn't stop. It's so intense. And I was like, hey, what's going on? I didn't realize it was going on because here in my room, the systems that we have in place make it virtually impossible for those pollutants to enter my room. So this is actually quite amazing. Everybody else can detect it outside, but for me, it doesn't really impact me. PM 2.5 is the fine dust particles 30 times thinner than human hair. That's why they are so dangerous, because they go into your lung. Now, the carbon dioxide, that was as well something that you guys already mentioned. It is coming from us humans. We breathe in the oxygen, we breathe out the carbon dioxide. So the more people you have into your office, the higher the carbon dioxide goes. And if you don't have fresh air coming in, then you have a problem. Your carbon dioxide levels will go to a level where you feel sleepy. Now, what actually in nature reduces carbon dioxide? What is that process called that we learned in school about? Another quiz question. We will have a prize for the right answer as well.
Ricky is fast.
He says plants. Yeah, I want to hear the scientific word for that process that plants and nature give us. Yes, Bianca, photosynthesis. That's what I was looking for, right? We learned that in biology. Oh, this is interesting. Bianca, I saw Bianca's answer first, but then Care answered it at the same time, more or less. So yeah, we will have to see how we can manage that with regards to our prices. Maybe Jeroen will throw in something else. Now, we have formaldehyde, we have virus, that is our main priority at the moment. The bacteria, the ions, all of these together have actually their presence in our offices without us being able to actually see them. So this is the American Psychological Association as well. They cross from the lungs to the blood, and in some cases travel up to the axon and hit your nerves into the brains. So this is serious stuff. It can lead to cognitive decline, those small particulate matter pollutants. Dirty air, is bad for your brain as well. This was the American Psychological Association saying that. This is very, very serious. So when we are going back to the new normal, to our offices, we do these kind of things. We manage access to the space. We implement the health protocols, the cleaning, the hygiene, the readiness of employees, and the indoor air environment concern. What else can we do inside of the building? We might still be facing some of these issues like irritation, fatigue, headache, respiratory illnesses, and the mental health aspect of it. Great things are being done in a lot of offices, parties, company outings. When you go to BPO offices in Metro Manila, you know, there's a bar there, there's a table tennis area. Looks great, feels great, but in some areas we don't feel good, and these issues might not have been addressed. The office that I used to go into before the pandemic has a small meeting room. Always when you're in that small meeting room, you feel sleepy. And then I took my indoor air quality monitoring device in it, very high levels of CO2. Why? Because the original design of the open plan office was an air inlet, an air outlet, but there is no air inlet, air outlet, or open window possibility in that small meeting room. It was partitioned at a later stage. So it's a small meeting room where no fresh air comes in. A couple of people are in there, the CO2 goes up and up and up. You feel sleepy. So here we have the United States EPA, even through the factors that affect the quality of our indoor air environment are numerous. The good news is that most problems can be prevented or corrected easily and inexpensively. Here we have the Mind You office. We did an actual evaluation of the existing air quality levels before we installed our indoor air package. On the left-hand side, you see the before. On the right-hand side, you see the after. When you can look at the summary at a glance there on the right-hand side, after the installation of our package, the PM 2.5 decreased by 70%. The PM 2.5, the small particles that go into your lung, decreased by 64%. VOC, volatile organic compounds, things that are as well very toxic. Those are they can come from glues, they can come from solvents that are being used. The formaldehyde, very toxic, was decreased by 100%. And the negative ions, which is good, which is what you have a lot of on the beach or in the forest, increased by 8,000%. So before, on the left-hand side, you see some of the areas were on the red side, like unhealthy levels. But after the installation of the package, there was a drastic change. And I've seen that as well here at my home. Actually, after we installed it a year ago, the first comment of my wife was, "Hey, honey, how come I don't smell the kitchen smell anymore?" And my dentist here in San Pablo City, he availed of the IndoorCare package. And when I visited him last year, he said, "Wow, Matthias, thanks for recommending this. I love it. And some of my other dentist friends have installed it. One of the main things I noticed, my wife noticed it. She said, darling, you don't smell anymore like a dentist before when you were coming from your practice. You know, this typical chemical dentist smell, gone." Here we have more examples of this. This is East Vantage Call Center. As well, we have 2 red areas and 2 yellow areas. Before, PM 2.5 was very good there. But after the installation of the indoor air package, everything went down to green levels. Another example here, remote co-working in Ortigas, excellent place to go, highly recommended. Before, several high levels, red was PM 2.5 formaldehyde, negative ions. After installation, all in the green area. That is what the package can deliver with real quantified measured outputs. Not just, you know, we will do something for you and then you kind of hope that it hits the right mark. We can prove it with the actual data. This is again the first example of Mind You represented in a different way, all massive improvement and changes through the installation. So what is IndoorCare? Actually, it's a holistic approach. And Jerome came up with this genius idea. You know, it shouldn't just be IAQ assessment. It shouldn't just be, you know, the action of monitoring. But let me just go back again to this. This is actually the Mind You office, Cameron. What was your take on this when you saw the massive change and when you first saw these figures?
Well, you know, I'm a data individual. I like data. Data tells a story. I think one of the most surprising things from our perspective was the fact that it was actually the glue underneath the carpets and the glue within all of the desks leaching out. Obviously, there's no windows. We got good aircon, and I mean, to be honest with you, this is a pretty new building, a really nice office, to be honest with you. So I was most surprised at being a very nice office for our staff, that it had such high levels in the first place. And again, I think data speaks for itself. I think it's important to look after our staff, and whatever we can do to do that, we'll do.
Great. Yeah, and this is interesting. You would assume that a very new and nice, fancy BGC office has excellent air quality already, but this is not a guarantee. I was once in Metro Manila in Makati in a platinum certified green building, and they were platinum certified, one of the highest accolades you can get. But when I was in their meeting room, same story like the other place, partition of meeting room, no fresh air supply, the CO2 levels were extremely high. So even a green or platinum certification is not a guarantee that your air quality levels inside are healthy. If you guys have any questions on these case studies or figures that we have given here, feel free to fire those questions into the chat. We can address them now. Jeroen,
yeah. You're so right about these buildings. We've done assessments for brand new buildings, really beautifully designed by known architects, beautiful interiors. But when you do the assessments, the indoor air, or not only the air, but the indoor environment, the light and sound and air, it's unhealthy, right? So, and we've done older buildings who are healthier. They just don't look so nice, but it has a better indoor environment. And that's what we are here to address, that healthy indoor environment is all we need. We spend most of our time indoors, most of our time going back to the office again. Now, how can we be safe and productive in the offices by addressing these issues? And we will be able to do this with IndoorCare. Yeah, when we entered Cameron's office, they had nice plans, a nice design.
Just a quick one, Jeroen and Matthias. Just reminding you of the poll that we have lined up specifically to ask what the individuals in the attendees are actually doing in their office at the moment.
Yeah, I think it would be great if we do that now, actually, if we launch the poll. Right. So let me do that. Then everybody can...
I've got it done from my side, Matthias.
Yeah. Okay, done. All right.
Done and done. Okay, so everyone... oh, so that's the wrong one. So 1 second.
That's the wrong one.
I'm just ending it. Let me just organize that, please, on my side. There we go. Okay. Everyone, I'm going to be launching a poll for all of you. There we go. What practices does your office implement to improve health? We'd love to get an understanding from you all. So we've got quite a few participants. Let us know if you don't see the poll for some reason. But if you can add your answers into there, I can see some coming in right now, which is fantastic. While we're doing that, we'll give that a couple of minutes. Let us know where you're from. Is everyone in Metro Manila? Is anyone here not in Metro Manila? Feel free to unmute yourself and talk, or put it into the or put it into the actual chat box.
Yeah, we have as well an interesting question from Yogesh. He's from India. And he is asking, how do we address the areas where no windows are available for fresh air? Actually, even in Metro Manila, we have a lot of windows, but you can't open up the windows. So, and that means you can't get any fresh air in, but the building was designed to have the mechanical air supply. But mechanical air supply costs money. And in some cases, the filters might not be that effective either. I've even been in a hotel, 5-star hotel, where I detected very high levels of carbon dioxide at night. And I spoke with the engineering guy. And the engineering guy told me, don't tell anyone. So that's why I'm not mentioning the name of the hotel. But we're switching off the fresh air supply at night to save money and to save electricity.
Matthias, so everyone's asking, so the poll only allows one choice. Apologies, that was meant to be able to do more than one choice. I'm unsure actually whether or not Zoom polls, I'm sure that you probably can do that. So my apologies, it was obviously not set up correctly. I do apologize. All the other polls are just one choice. So we've got 13 to 22 answers in. We've given it a couple of minutes. So at the moment, actually, we've got so a large percentage of the votes for indoor air quality monitoring and improvement, which is fantastic. We've got plants, we've got mental health policies. Okay, fantastic. I'm really happy to hear a lot of you have mental health policies. Hopefully some of you, it came through us. Some of you have air filters, and we've got 3 with none. So I guess the great thing is that those with plants and none and air filters, this is going to be fantastic education for you guys. And the ones with the indoor air quality monitoring and improvement, as well as the mental health policies, kudos to you all. And thank you so much for sharing.
Great. Excellent. So yeah, for that question, to just finish that one off, it only works if you have the mechanical air supply. If you don't have any mechanical air supply and no windows or spaces that you can open, then you're going to be in a very unhealthy building. But yeah, Reiki mentioned here, yeah, the guests sleep faster, potentially, because high levels of CO2 makes you sleepy. And that was a little bit of what the engineer as well commented, but it shouldn't be too high because then it becomes unhealthy and it could lead to migraine. So the good level of CO2, and when I was working for the ADB as a consultant, Asian Development Bank, they already had in 2016, 2017, the meeting rooms installed with CO2 monitoring devices. Once the level of CO2 was going up to 800 or more, their device would kick in and switch on the mechanical fresh air supply. So indoor care is really about the holistic approach, healthier indoor spaces, make it cost effective, affordable, and enhance the productivity and well-being of employees. Those of you who are listed companies and who are being evaluated by investment funds on your ESG, environment, social governance performance, this is actually a very important and material issue, particularly for all office-based organizations, that we focus more on employee wellness. Classically, it's been health and safety, and for a cement plant, health and safety is the higher priority, but employee wellness is really coming more and more, particularly as well driven by the pandemic. So what we have in the package is we have a surface coating that gets applied on your surface. It's made in the Netherlands, like Jeroen, stands for quality.
Thank you very much.
Yeah, and it goes onto the surfaces. I've got it here in my home office on the surfaces as well, and it eliminates bacteria and viruses effectively by 99%, including the coronavirus. So you actually have it sprayed on your computer, on anything, children's toys. It can go on all these things. Then for the air, and this is actually proven to be the biggest risk, we have a technology called plasma air, very famous internationally, used by a lot of big companies, big organizations, famous hotel brands all over the world. It's part of our package, and it's certified ozone-free. This is very important, and I've tested that as well here at home, because there are some ionizers out there in the marketplace that then have the negative side effect of increasing your ozone. But in our case, this is certified ozone-free, and it operates 24/7. It's done for you. It is on, and it can be used with humans' presence. It's very good. That's the difference with something like UVC. UVC is very effective as well in killing off the airborne COVID bacteria, but you cannot really use it with humans present. Otherwise, you get a problem in terms of the exposure. But this is certified a great solution for humans present. And I have had it on in my office for over a year's time. We even have it in our bedroom, only positive impacts to report.
Just quickly, I'm just going to move my my camera up. I don't know if you can see that little black thing. That's on the aircon vent. So that's on every single aircon vent in the office. Just to give you
we could see it. Yeah, even though it is actually a very small device, and you can individually control it as well. You have a little light when it's on. So this is really what the bipolar ionization stands for. The freshness, the negative ion. We installed it as well here locally in my wife's sister and brother-in-law. They have a Korean shop here. Even though they don't have an aircon, we installed it next to the fan. We made a video, and they actually said that some of their customers like coming there because they have it installed in their shop. It makes customers feel, extra supported, because the premise takes the risk minimization very, very serious. So this is the only solution that is not only most effective, sustainable, and it operates 24/7. You don't need to get the cleaning equipment out, or get the equipment out and switch it on, switch it off, or use it only when people are not present. This is on 24/7, done for you. No headache. it runs continuously. So, and it's been certified, and it's even approved by the US EPA. We really need to look after our employees. This is a material issue for sustainability, environment, social governance for all those of you that are from listed organizations. The last 10 years, the mega trend was green buildings. The next 10 years, it will be healthy buildings with good indoor health, because we have seen that this is a major risk for companies, ESG risk, both with regards to their own employees or their supply chain. We had a lot of countries where factories were shut down because their workers were affected either from the factory floor or from the places, the residential spaces that were provided. This has as well been one of the biggest challenges in Singapore, the COVID infection spread within the foreign workers that are working there. So this is really serious. And here in the Philippines, we have the sustainability reporting according to the SEC memorandum circular number 4, which has been in place since 2019. This is great stuff for your ESG social sustainability efforts. And in addition, with this being a great case study that you can report in your sustainability report, it will as well deliver lower sick leave and improvement of ROI. So these are the packages, Wellness and Wellness Plus. The Wellness one is the plasma air and the IAQ device, and the Wellness Plus is additionally the nano coating and the IAQ assessment. Maybe Jerome, you have some comments on the packages here and why you have made it so convenient for people to actually pay for them on a ongoing basis.
Yeah, well, what we started this as a subscription-based plan because people had a hard time paying it outright, spending a lot of money outright. They didn't really know when they would come back to the office or inside the building. The reason why I created these two packages is to the first package is that it already has the bipolar ionization, so it eliminates the airborne bacteria and viruses, and it reduces other pollutants. At the same time, you will be able to check it on a real-time monitoring device on what is going on in the office. And the Wellness Plus package is more extensive. It has the nano antimicrobial coating with it, and an annual indoor air quality assessment, which is our company is approved by Dollar, so you could use that for your how do you call that, annual requirements. Yeah, so we made it simple per square meter. We charge per square meter, and we have a 1, 2, or 3 year plan. I think the beauty is also we assign a health and wellness manager to your company. So this person will take care of your indoor environment. It will communicate with your human resources department if you have a nurse on site. So it's basically that we take care of your total indoor environment, so you don't need to worry about anything. That is the plan. We can roll it out internationally. We have approval from the plasma air supplier and the nano coating Clean. We have approval to run it in any country that wants us. So we're very flexible, and we're here to help schools. We can do it for schools, for entire commercial buildings, for malls, hospitals, any environment.
Thanks, Jerome. That's great input. I think as well, now is the time where you want to be as attractive as possible for a space, especially if you are a mall, a restaurant, a bank, a kind of hotel, office space. Some office spaces are empty because people have been working from home. This can actually be one of the best ways of standing out from the crowd by giving yourself this additional peace of mind and quantified improvement of air quality. Tess was asking about whether this helps with the DOLA regulation that's related to indoor ventilation. Actually, this goes far beyond in terms of how it improves the air quality. With the Wellness Plus, you will have your real-time IAQ device, that in itself will be able to help you to continuously monitor your CO2 levels, which is the main only quantified aspect of the DOLA regulation, that it shouldn't go above 1000 ppm. But we actually tackle all the toxic gases in the air, like the formaldehyde that you often have in the new offices. And we as well eliminate the airborne and the surface virus particles. We have the paperwork as well and certifications for that. In the case of bipolar ionization, there was a study done with the Spanish government in a hotel outside of Terminal 4 in Madrid. This was a hotel where patients were in isolation, and it was tested with a COVID a proxy, like, you know, those little bacteria that are exactly like the COVID viruses, but slightly different, because you can't really mess around with the COVID particles themselves in such an environment. And there was a 99.9% airborne elimination after 10 minutes of testing period. So this is good news. And that way you can really do a lot more to prevent the risk. There will never be zero risk. You know, if someone that's infected is standing next to you and sneezing at you, then no solution can really completely eliminate that. Maybe your mask that you should be wearing can prevent it. But this is what we have in the package, and it will definitely help us well with that DOLA requirement. So,
Matthias, before you go on, so there's a question from Tess. Is the national government's recent department order on ventilation guidelines for indoor places and public transportation in the right direction in terms of improving indoor air quality? Would indoor care systems be aligned with these guidelines?
Yeah, I think actually that the guideline is good. It's a good step. The CO2 levels is the main proxy for whether you have fresh air or not.
Sorry, Matthias, I think you already responded. Thanks, Tess. Much appreciated. Sorry.
Yeah. But yeah, I mean, the question goes slightly further than my answer. So I'll add one or two more things. I have measured CO2 levels in buses, jackliner from Laguna to Metro Manila, because I'm a hardcore fan of public transport. I had CO2 levels of 6,000 and above. Nobody knows this. I posted it on Facebook. Very unhealthy levels because there's no fresh air coming in. So we go far beyond the DOLA requirements. We think a lot more can be done to reduce virus risk, but this is a good start. And CO2 tracking and ventilation to reduce the CO2 levels and get fresh air in is definitely recommended. But what we have is even more comprehensive in reducing your risks.
Actually, we have installed also indoor care in employee shuttle vans for many BPOs. So we have small plasma air units that can fit into car air cons, and we spray the inside of the van. So, and I mean, this is something we could roll out in all taxis all over the world, all over the Philippines, in all public transport. Indoor care is possible.
Yeah. So choose your plan, wellness or wellness plus. Both plans are great. I have the wellness plan here at home. I love it. The family loves it. And we actually in the pandemic expanded our space. So we are looking forward to installing it as well in the additional unit that we rented next door, because I wanted to have my bigger home office for the work that I'm doing. So really, we are really happy to partner with you, to partner with Mind You. Our plans are finely tuned. Really, we will make it to your requirements, and we will give you a competitive edge, both on productivity, employee wellness, and the customer reach out that you will have with this extra things in place to give you that competitive advantage. So yeah, we will have as well these certificates that you can then use for your premises to show that you're really taking this serious. And our aim is to make the employees happier, healthier, more productive through optimizing your indoor environment, making it accessible and by that protecting the physical and mental well-being. Thanks a lot, guys. I hope you enjoyed it.
Now,
and we still have, yeah.
before we have everyone jump off, I have a quick poll, a quick survey that I'd hopefully like to get all out to you. So I'm going to relaunch this poll. So after watching this webinar, what did you learn about? What did you learn the most about? And if you'd like someone, if you were interested in someone to actually follow up with you, whether Mind You, IndoorCare, or both of us, you know, we're both definitely, I think the collaborative effort is really, really important for, you know, making sure that we can look after our staff. I think that the organizations who are doing this are showing incredible leadership to ensure that their staff are well looked after. And I hope you got a lot of value out of this, out of our first webinar, out to the public.
Very much, Cameron.
The partnership with IndoorCare and Mind You.
And if there are any questions, you know, fire them off in the chat box or ask them.
Also, everyone, Sandra has posted a link in the chat. There's a survey. We'd love to be able to get your feedback about the event. Feedback is extremely important for us to continue to improve what we're doing, improve the articulation, education. Is there anything else that you'd like to know or understand in regarding to this? Yeah, I really hope you were able to get a lot of value. And I just want to say thank you to Matthias and Jerome for spending their Thursday evening with us to go through their products and educating us all on why indoor care is important.
Thank you very much for having us, Cameron. It's much appreciated.
Thank you so much.
Thank you everyone for listening in and asking these great questions. And hopefully both Mind You and IndoorCare can help your organization.
Yeah, and definitely we will be in touch as well with those who deserve a prize. It was Reiki, Care, and Bianca. We will get in touch with you and arrange for the extra benefits. I will as well be happy to send all of those that get a prize a PDF copy of my book, The Green Man's Guide to Green Living and Working, if you want one. And yeah, I enjoyed it. I think it was a lively session. Great that you guys participated with comments and questions. It's always good. And thanks a lot.